Welcome to the Deep Dive. Today, we're taking a really close look at turmeric, that bright yellow spice, probably in your kitchen cabinet right now.
Yeah, exactly. We've gone through quite a bit of material on it.
And our goal, really, is to pull out the practical stuff. How can this root and, well, the things in it actually help improve your well-being? Without a ton of effort, ideally.
Right. We're looking beyond just, a sprinkle here and there. The sources really highlight two main players inside turmeric. There's curcumin, which most people have probably heard of.
That's the famous one, yeah, associated with most of the health buzz.
Definitely. But then there are also turmerosaccharides, maybe less known, but potentially easier for your body to actually use.
Interesting. Okay, let's start with curcumin then, since it gets so much attention. The anti-inflammatory aspect seems pretty significant.
Oh, absolutely. The evidence points strongly that way. We're seeing potential for pain reduction, after surgery or for arthritis pain, even just general aches and pains.
And I saw some comparisons mentioned even to things like cannabis compounds.
Yeah, that was interesting. Some studies suggest curcumin might offer similar levels of pain relief, maybe even with fewer side effects. But it's specific contexts, specific types of pain.
Sure. Nuance is key.
And the comparison to standard anti-inflammatories, like ibuprofen, is also compelling. Research suggests curcumin can be really quite potent.
Potentially more potent in some cases.
In some instances, yes, and possibly with fewer or less harsh side effects. That combo effectiveness and maybe being gentler is what makes it stand out.
Okay. And for arthritis specifically, you mentioned that. It helps the pain, but maybe not everything.
Right. So the studies tend to show a reduction in pain associated with arthritis, which is great. But maybe not so much for the stiffness aspect. That's an important distinction for people.
Good to know. Now, switching gears a little, what about mood? That came up too.
Yes, that's another potential benefit. The research suggests curcumin might help improve symptoms of depression.
How would that even work?
Well, a couple of ideas there. One is reducing inflammation, which we're increasingly linking to mood issues.
Okay, that makes sense.
And the other mechanism is possibly inhibiting something called monoamine oxidase, or MAO.
MAO rings a bell. Isn't that related to antidepressants?
Exactly. Some antidepressants work by inhibiting MAO, which kind of clears away mood chemicals. Curcumin might have a somewhat similar action.
Well, okay. That's quite a connection. And didn't the sources mention something about saffron?
Yeah, combining it with saffron seemed to show even better results for mood in some studies, a kind of synergistic effect.
But it takes time, right? This isn't like an overnight thing.
Definitely not. The study suggests you might need to be taking it consistently for, say, 2 to 3 months to really notice a difference, so it's more of a longer game.
Right, patience needed.
And we shouldn't forget its traditional use for digestion.
Oh yeah, like for upset stomachs and things?
Exactly. Conditions like IBS, general gut inflammation. The sources point to curcumin helping there, too. It seems to block a key inflammation trigger in the gut called NF-kappa beta.
NF-kappa beta. Okay.
And it might also reduce certain inflammatory white blood cells and chemical messenger cytokines right there in the gut lining.
Seems quite targeted.
Hmm.
And was there something about fennel oil?
Yes, some suggestion that combining it with fennel oil might boost those digestive benefits even more.
Okay, so curcumin sounds promising on many fronts, but isn't there a catch, like getting it absorbed?
Ah, yes, you've hit the nail on the head. That's a critical piece. Most of these studies showing big benefits, they're using concentrated curcumin extracts.
Not just the powder from the spice jar.
Right, because curcumin itself is fat soluble. It doesn't dissolve well in water, which makes up most of our bodies.
So you need fat to absorb it properly.
Exactly. Taking it with things like coconut oil, olive oil, fish oil, any kind of healthy fat source can really help your body take it in.
And what about black pepper? That always seems to come up.
Right, bioperine. That's the active compound in black pepper. It significantly increases curcumin absorption, like dramatically.
Which is why you see it in so many supplements together.
Precisely. But it's also worth saying, even if it's not absorbed systemically super well, it can still have benefits right there in the digestive tract because it doesn't need to get into the bloodstream to work locally on gut inflammation.
Okay, that makes sense for the digestive angle. So even if absorption is low, it might still help the gut.
Correct. Now, what about those other compounds you mentioned earlier, the turmerosaccharides?
Yeah, the underdogs. What's their deal?
Well, they're actually the vast majority of what's in turmeric root, like 95% or even more.
Whoa, really? So curcumin is just a small fraction.
A very well-studied fraction, but yes, small percentage-wise. And the interesting thing about turmerosaccharides is that your body might actually utilize them more easily from the whole root compared to trying to get curcumin from it.
Easier to use. How come?
The key difference is they are water-soluble.
Ah, unlike curcumin, which needs fat.
Exactly. Since our bodies are mostly water, these dissolve and get absorbed more readily.
Okay, so easier absorption. What benefits do they offer? Are they different from curcumin?
Somewhat different, yes. The research highlights their role particularly in muscle and joint recovery. Think after exercise or maybe overdoing it physically.
So less soreness, faster recovery.
Potentially, yes, helping reduce pain and stiffness faster. And they've also shown promise in studies related to osteoarthritis, helping reduce pain and swelling there too.
That's huge for active people or anyone with joint issues. Is there anything about protecting the joints long term?
Yes, there's evidence suggesting they might help preserve cartilage.
No.
By reducing inflammation, of course, but also by potentially protecting key components of cartilage, like glucosaminoglycans and type 2 collagen, from breaking down.
So potentially slowing down joint wear and tear.
That's the idea, helping maintain those structures for longer.
Okay, this is fascinating. We have curcumin, needing fat and pepper for best absorption, good for inflammation, mood, maybe digestion. Then turmerosaccharides, easier to absorb, maybe better for muscle recovery and joint health.
Right, two different toolkits within the same root, essentially.
So how do we actually use this information? What are the practical steps?
Well, the big takeaway for curcumin is always take it with fat. That's crucial if you're aiming for those systemic benefits like mood or general inflammation.
Got it. Fat is key.
And consider black pepper or supplements containing bioprine to really boost that absorption.
Fat and pepper for curcumin. Check. Now, the sources also mentioned combining turmeric with other things for even better effects. Synergies.
Yes, some really interesting potential combinations. One involves enzymes like serrapeptase.
Serrapeptase, what that?
It's an enzyme originally found in silkworms, actually, or the bacteria within them. It helps break down non-living tissue, like damaged tissue from an injury or overuse.
So it helps clear out the debris, so to speak.
Kinda, yeah. Which can potentially speed up recovery, reduce swelling, and ease that post-exercise muscle soreness. Combining it with turmeric could be a powerful anti-inflammatory approach.
Like a first step for minor strains or soreness.
Exactly. Maybe something to try before reaching for standard pain relievers, potentially. It's a natural option derived from bacteria or silkworms.
Interesting. And there was another one mentioned, haritaki from Ayurveda.
That's right. Haritaki is one of the 3 fruits in the traditional formula triphala. It's rich in tannins.
Tannins, like in tea or wine.
Similar idea. These specific tannins seem to inhibit inflammatory molecules, particularly one called TNF-alpha.
So it tackles inflammation from a different angle than curcumin.
Precisely, making it a potentially great partner for turmeric and maybe even serrapeptase, creating a sort of multi-pronged attack on inflammation. It really shows how combining these natural compounds might offer broader benefits.
Okay, wow. Lots to think about there. Let's try to wrap this up. We've done a deep dive into turmeric, pulling apart curcumin and turmerosaccharides.
Looked at the benefits, the absorption challenges, the potential synergies.
And it seems the bottom line is turmeric holds quite a bit of potential, doesn't it? For pain, inflammation, maybe mood, digestion, joint health.
Absolutely. And importantly, the research generally suggests it has a pretty good safety profile. The risk seems relatively low for most people, while the potential rewards could be quite high.
So for you listening, maybe the next step is just thinking about how you could work turmeric in. Maybe it's just being more deliberate about adding it to your food with fat and pepper.
Or trying a golden milk latte with coconut milk, perhaps?
Yeah. Or if you have specific goals like tackling joint pain or inflammation, maybe looking into specific curcumin or turmerosaccharide supplements makes sense, keeping those absorption factors in mind.
And that leads to a final thought, really. We talked about combining turmeric with things like serrapeptase or haritaki for enhanced effects.
The synergistic approach.
Exactly. So the question to mull over is, what other natural tools or combinations might be out there? If you understand how these things can work together, like we've explored with turmeric, could you apply that thinking to other areas of your health and well-being? Exploring those interactions could be a really powerful next step.